Philip, the first question I want to ask you is, what do you think is the biggest challenge for brain health globally?
Yes, very good question. The biggest challenge is probably that the awareness is lacking that brain health is so important. So people now realize that physical health is important, jogging, etc., but we really have to leverage that and explain how important it is to take care of your brain health, and that there are specific things that you can do that actually are really improving your brain health outside of what you do for your physical health.
And what do you think those things are? What can we do about brain health?
Well, yeah, things like social engagement, sort of keeping in touch with reality and having friends and family and keeping in touch with and making connections. So I think the biggest advice you can give to people overall is keep on making connections. Physical connections, but also brain connections. So learn a new instrument, take a new job, do something completely out of the ordinary, and that creates new connections in your brain. And we know the better the network in the brain is, the better it's connected, the more it is protected against Alzheimer's and other diseases.
Fantastic. So keep making connections.
Yes.
And what innovation do you think in the whole area of brain health excites you most for the future?
Yeah, so the innovation, I think I'm a doctor, so I like you, and I always think of brain health as preventing diseases and trying to get grip of the diseases that are sort of challenging our brains. So for me personally, it has always been the drive to try to cure Alzheimer's disease, cure all these neurodegenerative diseases. That will result in a better brain health, of course. And in terms of innovation in brain health itself, I think the notion that we know now better how to improve brain health and what you can do to improve your brain health is already innovative and should be applied in sort of society more broadly.
Yeah, and of course there's all the advent of these likely low-cost, cheaper alternatives to the current gold standard imaging tests, such as blood biomarkers or digital biomarkers, or perhaps even fingerprint tests, and it can make a huge difference to predicting the disease much earlier.
Absolutely, and that's a very important point. So the predicting of the disease much earlier makes people aware, I have to do something now in order to prevent the disease spreading and being demented at the end. So even if the test is positive in the sense that it is abnormal, people will realize, I have to do something now. I have to really do some and act now. And I think that will improve brain health, resilience to the disease that is sort of coming.
And of course there's lots of things people can do right now. I think people don't realise that there's a whole suite of potential activities, such as making sure that you are in good physical health, with your blood pressure checked, your cholesterol low.
All those things, yes.
Doing lots of physical activity, as you said, brain activity, all these things can help. And then of course there's some pioneering therapies coming on the market that in the future could make a real difference.
Absolutely, absolutely.
Yeah.
So we cannot just totally prevent Alzheimer's by sort of brain health. So I made a lot of mistakes in my life telling patients, you should be more active, you should do this. Just, doctor, I already run the marathon twice a week, so what can I do more? So you have to be personalized also in that advice. So what is good for one may not be good for the other. So we have to think also how can we personalize this more?
And help educate people better and make them understand it better and understand that they can make a difference if they step in right now.
Yeah, absolutely. Now, Sam, let me ask you a question. What are the insights you gained actually by talking to patients and experts that have changed your own sort of perspective?
Yeah, well, that's a very good question. And actually, I've talked to patients and advocates and carers for many, many years as a doctor and through my different work roles. And what I've really learned is that there is no time to wait. There is a sense of urgency when you have one of these devastating conditions, either dementia or a rare dementia, which in our case we're particularly focused on at LifeArc, which means you can't wait the normal 10, 15-year process for a drug to be developed. You need to have that support much earlier. And actually there is a huge unmet need in trying to get that support to people. And we need to think and act as urgently as patients and patient groups. And we need to think about our regulatory processes and our other processes to get these really effective diagnostics and treatments to people much sooner, and think like they think rather than the way that sometimes we more traditionally think. Be much more disruptive, be much more innovative.
Yeah. Do you think that sense of urgency is already sort of shared enough? I mean, are there enough people to share the sense of urgency with you with LifeArc?
I think it's not as embedded as it needs to be, and I
No.
think we need to co-create much more with patient groups and advocates, and have them much more on our team, so that we can absolutely not forget about it every single day of our working roles. So we understand why we're there, what we're trying to achieve, and why it matters to move fast.
Yeah, absolutely. And patients know best in that sense, so they can advise you a lot. Yeah.
Can I ask you the same question? What have you learned from the patient groups and communities you've talked to over the years?
Yeah, so well, over the years, so I've talked to patients for 30, 35 years, and I've always sort of, my inspiration to do research has always come from patients. They ask the questions that nobody asks. I mean, patient sort of, even if you diagnose them, they say, okay, doctor, but what is next? So where am I in a year or 2 or 3? So that prompted us to think better about prognostic biomarkers, not only diagnostic biomarkers, but also prognostic. Those are lacking yet, but those are important questions because people want to know. A diagnosis by itself you can manage, and you say, but the sort of what you're seeing in front of you, you want to have an expectation, you want to manage your life.
Yeah.
And will this be for 2 years, for 3 years, for 10 years? We don't know.
No, you absolutely want to know what the future holds, don't you? And
Exactly.
And are you going to live with good quality years, or are you going to be very poorly, and plan your life accordingly?
Exactly. We would like to have markers or indications to discuss this with the patient, where you're the typical patient that I think you have a slow course of the disease or a very rapid course of the disease. Those are important things that people want to know.
Yeah, you're so right.
Sam, another question. We've been talking about brain health, we've been talking about diseases, but there's also an important sort of knowledge probably lacking about why women and women's health is so important and different from men's health, actually, also in terms of disease.
Yes.
What are your views on that?
Well, I mean, it's a very important point, because actually women are much more likely to get dementia in the longer term than men. Yeah. And it isn't just about that they tend to live longer, it's actually the incidence is higher in women than men. And we don't know enough about it. We know there's lots of possible contributing factors, like you're more likely to get menopause, post-menopause dementia symptoms. But actually we need to understand, is it to do with being caregivers? Is it to do with being various stresses from sometimes being in lower paid roles, which means that educationally you don't maybe have the option to have as much brain activity? What's really causing this? So important, because it is so much more dominant in women than men. I think it's
so different.
Isn't it 2/3 in women compared to men?
I think so. Yes, especially after menopause. It's increasing rapidly. And it's all these factors that you mentioned, plus that some of the risk factors, genetic risk factors that we know, like ApoE4, they act differently in men than in women. So that's just early signals from research, but we really have to capitalize on that part of research. We need to know better, because ultimately, as you also said, I mean, usually in many countries, still the care for patients with dementia rests on the women. And if they then become ill themselves, where are we ending?
Yeah, no, it's a real societal problem.
Absolutely.
And we need to do far more research into it.
Yeah. So Sam, we talked about women and getting more dementia. 2/3 of the dementia population is women. So what are we doing? What do we need to do? What can we do?
Well, it's a huge problem, because it's a problem, of course, because this actually hits people when they're actually in the workforce. So women are much more likely to start to get dementia symptoms post-menopause, and actually so it's affecting working age women. Women are principal caregivers, and so that can be a real problem for if they're caring for someone else and they start to get dementia symptoms. And also women are often the main employee in big healthcare systems, and so we need to really think about how do we support women's health and brain health better. And at the moment, we're not doing nearly enough research into why it's happening and what are the exact causes in different to men, and what can we do about it.
Absolutely, it's actually amazing. If you mention all these arguments, it's actually baffling. Why doesn't anybody do something about this particular issue? Why isn't it studied better? And so is there a barrier? Can you think of a barrier why people don't do this?
It's surprising, isn't it? Firstly, that people don't pay more attention to it, and why are we not screening women earlier? We seem to not pay the attention to screening them to get them even diagnosed earlier. So I think the first start is an educational piece, that this really matters. Women are more likely to get dementia, and the second piece is how can we get early screening tools, such as these new blood-based biomarkers we've talked about, or digital screening tools, that means that they can find out if they're at risk of dementia much earlier, because of course, as we said earlier, you know, the window of opportunity is sometimes 15, 20 years out from the final diagnosis. And then we can begin to understand what type of dementia they may have and what treatments we might be able to offer them. Philip, you're a top leader in the field of dementia, and I'd love to hear your reflections on what you think the biggest change has been in dementia, diagnosis, treatment or care in the last 30 years.
Yeah, it's funny that you say that. It's been a long career, and it's actually very interesting. I've witnessed Alzheimer's for being a non-issue to where we are now as a very big issue, worldwide recognized, and also for not being able to even diagnose patients properly. As I think you said also somebody else, I think we were wrong half of the time because we didn't have anything to really look into the brain and what's happening there. So we made a diagnosis on a phenotype, and that has changed completely. So MRI, CSF, PET scanning, blood-based biomarkers. I've seen all that, and in my span of career, it's so exciting to have seen this from nothing to where we are now. And what you're doing with the blood-based biomarkers, actually on a drip of blood, sending it over and getting a diagnosis, that's really revolutionary. And if you had asked me 5 or 10 years ago, would that ever be possible? I said, no, never possible. You need invasive tests, you need CSF or something. So that's one thing. So the biomarkers completely changed the whole field. And by that, you also have seen changes now in drug development. Because of the biomarkers, we can now do drug development much better than we did before. We know the targets, we can identify the target, we can identify the patients, we can follow the patients, and we can measure the effect. So that I've seen, and that I'm really very happy that has happened in those sort of a few years. For the next 5 years, it's always difficult to predict the future, but I think we'll go even a step further. What we have achieved in Alzheimer's, we should achieve in FTD, in ALS, in all these other diseases.
So those are the rare dementias like frontotemporal dementia.
Absolutely. They are underdiagnosed. And they're usually misdiagnosed in Alzheimer's.
Yes.
I have so many examples of that.
And delayed diagnosis
and delayed
as well. Sometimes up to 4
because
to 5
he's starting
years.
to behave differently. So it must be a psychiatric disorder. No, it can be FTD. So having a proper biomarker for that, and that's actually, I think, the next step that we really have to make. And that will happen in the next 5 years.
Yeah, fantastic. So exciting.
Good. Yeah, so
Thank
exciting.
you.